have a patient with right upper quadrant pain that I need to rule out gallstones on, so I'm going to get Dr. Dan Haggerty, my ultrasound expert, to come and do a scan. He's going to demonstrate basic gallbladder scanning, some tips for difficult to scan patients, and also show us some pathology. Come on, let's go. As with most bedside ultrasound exams, the ultrasound machine is positioned at the right side of the bed. The machine should be set to an abdominal or gallbladder preset. For this study, Dr. Haggerty is using a standard low-frequency curvilinear abdominal ultrasound transducer. Gel has already been applied to the right upper quadrant area, and Dr. Haggerty will start scanning in the sagittal plane with the transducer indicator towards the patient's head. The transducer indicator corresponds to the indicator marker on the ultrasound screen. So in the sagittal plane, the patient's head is to the left of the screen and the feet are to the right. We start with a transducer in the midline, just under the rib cage, and then sweep slowly towards the patient's right. In most patients, you'll see the liver with the gallbladder in long axis at the inferior edge of the liver, between the left and the right lobes. If your patient has eaten recently, the gallbladder may be very small and difficult to find. As a helpful landmark, the kidney lies just posterior to the gallbladder, and the portal vein is often seen adjacent to the gallbladder, making an exclamation point. Often, the main lobar fissure, a bright white line, can be followed from the portal vein directly to the gallbladder. Sometimes, in order to get the gallbladder into true long axis, the indicator needs to be turned slightly towards the patient's left, because by convention, the fundus of the gallbladder is always shown on the right side of the screen. Once you have found the gallbladder in long axis, scan all the way through the gallbladder, looking for stones and wall thickening. Make sure you get an adequate view of the neck of the gallbladder. The gallbladder is normally less than 10 centimeters in length. At this point, the image can be frozen, labeled, the long axis measurement obtained, and the image saved or printed for the chart. Now we're going to look at a little bit of pathology. On the left side of the screen is the normal gallbladder in long axis, and on the right side is an ultrasound clip of a gallbladder filled with large stones. Notice the dark shadowing behind the stones. Sometimes, when the gallbladder is packed with stones, the posterior wall and everything behind it will be completely obscured by the dark shadowing. Once the gallbladder has been completely examined in the long axis, turn the transducer 90 degrees so that the indicator is towards the patient's right side. The gallbladder will now appear nice and round in the short axis view. Scan all the way through the gallbladder in short axis by sliding the transducer towards the patient's feet to see the fundus and towards the head to see the neck. You may need to angle the transducer rather than slide it to get under the rib cage. Or, as you can tell in this patient, we are actually scanning between the ribs. In the short axis view, the normal gallbladder measures less than 4 centimeters in diameter at its thickest point, and the wall, which is measured at its superior edge, measures 3 millimeters or less. The short axis view should also be saved or printed for the chart. Now we're going to look at a little bit more pathology. On the left side of the screen is a normal short axis view of the gallbladder. On the right side are two still images demonstrating many of the findings of cholecystitis. The gallbladder wall is edematous, measuring almost a centimeter at the superior edge, and the gallbladder is distended, measuring nearly 7 centimeters in the short axis. In addition, the gallbladder is filled with sludge, which appears as a non-shadowing gray mass. And on the right side of the gallbladder are a number of small stones with shadowing behind them. If there are stones or evidence of cholecystitis, you may want to scan the common bile duct. Finding this structure is covered in the Access EM video on hepatobiliary ultrasound. Another sign of gallbladder pathology is the sonographic Murphy sign, which we'll demonstrate. As Dr. Haggerty is scanning along the liver, he will ask the patient where she's most tender. If the point of maximal tenderness is when the transducer is pressing directly on the gallbladder, it's likely that the pain is due to gallbladder pathology. If the point of maximal tenderness is away from the gallbladder, biliary pathology is less likely.
Ouch, that hurts.
That gallbladder wasn't too hard to find, but sometimes it's a lot more difficult. In this patient, we're scanning along under the rib cage in the sagittal view, but all we can see is gray-white bowel gas. In this case, we can get the patient to help push the gallbladder into view by taking and holding a deep breath. Both the short and long axis of the gallbladder can be scanned in this method. Just make sure you let the patient breathe in between the scanning. Another technique that's often useful if the gallbladder can't be seen due to bowel gas is to have the patient turn onto their left side. This moves the bowel gas out of the way and brings the gallbladder closer to the anterior wall of the abdomen. Now that Dr. Haggerty is done with the ultrasound on my patient, I know she doesn't have cholecystitis or even cholelithiasis, and I've ruled out gallbladder pathology as an etiology for her pain, without sending her to radiology for an ultrasound. As you can see, ultrasound performed by emergency physicians at the bedside can be a great time saver.